Welcome everyone to Pandemic Parenting from Children's National Hospital. I'm Barbara Harrison. Well, we know that COVID-19 has families tackling a wide variety of new parenting challenges, and Children's National Hospital is here to help you out. Today, I'll be speaking with Dr. Al Bellard, a pediatrician with Children's National Hospital, and we're so happy to have you with us, Dr. Bellard. Thank you for joining us.
Thank you, Barbara. I'm very happy to be here.
While this pandemic is far from over, things are starting to reopen across the country. We know that many parents are feeling anxious, and understandably so, about starting to resume normal activities. Many parents are still postponing vacations, shopping trips, play dates, but they also may be postponing a medical visit to the doctor. What do you think about that? Why should people have to think differently about postponing those trips to see a physician?
Sure, and everything that we normally do has been completely disrupted as a result of this pandemic. And so it's very easy to forget about all the issues that can negatively affect our health, like high blood pressure, depression, anxiety, and obesity. And generally speaking, these aren't issues that we like to talk about. So a pandemic can end up being a perfect justification to avoid routine health care. However, it is essential that now more than ever, we take steps to ensure that we remain strong and healthy as ever to keep our immune systems intact. This helps to protect us not only from the coronavirus pandemic, but also from the multitudes of other viral and bacterial infections that have existed in our community well before this pandemic began.
And speaking of that, the CDC released a new study last week that was essential to public health. It was a warning that we don't get vaccines back on track, that the coronavirus won't be the only disease parents will need to worry about, as you were just saying. Can you tell us more about that?
Sure, we've seen a significant drop in the rates of childhood vaccination rates across the months for a couple of reasons. At the beginning of the pandemic, many practices delayed routine care either completely or with some limitations to infants. And of course, many families were reluctant to schedule well child visits at their doctor's offices for fear of actually contracting the virus. The concern now is that as states across the country relax the stay-at-home orders and people return to more normal routines, we are going to have to contend with common vaccine preventable diseases like measles, chickenpox, mumps, and whooping cough.
You know, I think a lot of people probably think that their doctors don't have their offices open right now because we know hospitals, the emergency rooms weren't letting just anyone come in. So I guess a person needs to call their doctor to make sure that they are actually seeing patients, right?
Absolutely. And I think that many practices have adjusted their hours. And so it's really important to reach out to your healthcare provider to determine, first of all, if they're open, and second of all, what are the modified hours and scheduling practices that they've implemented in response to this pandemic.
You know, a lot of yearly physicals, as we know, are tied to back to school and sports. Is there a concern that changes to the start of the school year this fall could further impact this issue?
Absolutely. And so part of the message that I have is for parents to reach out to their healthcare providers now to determine if their child is due for a physical. As you mentioned, there's uncertainty about when school will actually start. However, most practices throughout the area are open today to ensure that the healthcare needs of our families are met.
Now, if your child isn't due for vaccines right now, should you keep up your well visits, or are those okay to put off?
I would strongly urge parents to keep their children on track for their routine wellness visits, even if he or she is up to date on their vaccines. A comprehensive visit involves more than just shots. It includes appropriate developmental screens, labs, as well as a complete physical exam.
What do you think about those telehealth visits? That's an ongoing option for a lot of people. Is it best for kids past a certain age to be seen via the computer?
Sure. I believe that well child exams should occur in person when possible in your child's medical home in order to establish and maintain a continuity of care. However, if your child's primary care provider has successfully implemented telehealth to conduct part of that exam, it's a great option. These telehealth visits should be followed by a brief in-person exam. For now, we've been prioritizing our in-person wellness visits for children up to the age of 2 and offering telehealth wellness visits for those children who are above that age.
What can you see of the child on a televisit? Can you, I guess, do you have check them for rashes and things like that as well?
Sure, yeah. For routine, for what we call urgent care or follow-up visits, telehealth visits can be ideal. We can get a good history, collect information, and we can actually see the child. We can look at rashes. We can see if they're actually in distress or if there's some other concern going on. A big part when it comes to the wellness visits of conducting the telehealth has to do with development. We can look at developmental screenings. We can see if the child is walking. We can hear the child verbalize. And so we can get a lot of useful information from a telehealth visit.
Do you have any advice for parents to make them feel a little more confident in going back to the doctor's office at this time?
Sure, I would definitely say that practices have implemented several strategies to assure safety, such as scheduling well visits and sick visits at different times of the day. And we're screening all visitors who enter the facility for fevers and other symptoms of COVID-19, not just visitors, but also staff members. The waiting rooms in medical offices have been restructured and reconfigured to ensure that appropriate social distancing is intact. And cleaning and sanitation efforts have also been stepped up tremendously. Patients now are being scheduled responsibly to avoid those crowding waiting areas, and families are being allowed to wait in their cars even if they choose. I believe, Barbara, that the crowded waiting rooms of the past where people sort of sat elbow to elbow are history, and I hope that we actually never return to that.
I know a lot of
Go ahead.
doctors' offices actually have a separate room for those coming in who are not well and those coming in for their well child visits, right?
Absolutely, and we've certainly implemented that at Children's. In addition, healthcare providers are committed to ensuring the safety of their practice environments. So we really want to keep our patients safe, and we want them to know that we're doing everything to make sure that their visit is as safe and healthy as possible.
Let's switch gears just a little bit to talk about the importance of kids being exposed to germs. How does being at school and around other kids impact your child's immune system?
So, it's not uncommon at the start of a new school year for us to see a few more mild illnesses like some colds and maybe pink eye. And those are fine. We don't worry too much about those because those are easily treatable and don't usually cause any significant problems for families. The disease, of course, that we worry about are those vaccine preventable diseases that have the capacity to cause severe harm and damage to the child. And that's, again, why we really want to stress immunizations and vaccines, because we don't want kids to get all back out there and all of a sudden we're seeing a huge spike in the cases of measles and chickenpox. So I'm not too concerned about common colds and viruses that we face every day, even at home. But the more severe illnesses that we worry about are the ones that we have vaccines to prevent.
Well, as a mother, I know that at the start of the school year, it always seems like our kids are coming home with everything and bringing it home with them. But,
Yes,
I guess they need to get into the doctor to make sure they don't get some of the more serious illnesses.
absolutely. And that's where vaccines come in handy. And we're doing everything to make sure that families can access us and reach us and keep our patients up to date on all their vaccines.
Could prolonged staying at home hurt your child's immune system? Like we're doing right now. Kids have been home since March, I guess. Should they be? Is it better for them to be exposed to more illness?
So staying at home really won't hurt your child's immune system because, quite honestly, there are enough bacteria and germs in every household to ramp up their immune system. Again, they might get more exposure to more cold viruses once they get back out into to school and other public surroundings. But the real danger to kids who are staying at home are kids who don't go out and get their vaccine. So the common germs that are out there are going to be in public settings and in home environments. The things that we worry about, quite honestly, are those germs that that can cause serious harm to them and can be prevented with vaccines.
Well, we've had questions from parents who would like for you to answer, and I've got one for you here. As allergy season is here, a lot of parents worry that stuffy noses and sneezing could mean a virus. How do we know that this is a different virus than the one that everybody is so afraid of right now, the COVID-19?
Absolutely. And Barbara, this is a common scenario in our practice. Every day we are sort of confronted with trying to differentiate those common allergy symptoms, especially now that we're in the midst of allergy season. I would say that typically allergies are associated with what we call those itchy symptoms, itchy eyes, itchy nose, and sneezing. Those symptoms are usually relieved by your routine allergy medicines. Symptoms of COVID-19 typically are those allergy symptoms accompanied by fever, cough, shortness of breath, and lots of body aches. These symptoms tend to be a lot more severe and would warrant an immediate call to your healthcare provider.
Anything that you want to say about what kids should or what parents should look for just in case there might be something going on that's a little more serious when it comes to virus?
Absolutely. I think that when it comes to trying to determine if your child has been exposed to this, you certainly want to look at your family risk factors. Have you been out in a public area where you could have possibly been exposed to someone? You want to look at your child's behavior. Most parents have become pretty familiar with what's normal behavior and what's a normal activity for their child. So just paying attention to your child's overall behavior. If a child is acting sick, even if they don't have all the different symptoms that we talk about, call your healthcare provider. Let us help you sort it out, and keep our numbers handy, because we are here. We've been open throughout this pandemic, and the last thing we want is families sitting at home trying to sort this out by themselves.
Well, we thank you so much, Dr. Bellard, for being with us and sharing your expertise. I know you've been there at the hospital for quite a long time. I'm sure a lot of our patients know you from their Children's National and taking care of their kids. I know it was great information for all families who've been watching. If you have questions for Dr. Bellard that he didn't address today, put them in a comment section of this video and we'll get back to you with a response. For more parenting tips, make sure to check out Rise and Shine, childrensnational.org, which has lots of advice for keeping kids healthy and happy from the experts at Children's National Hospital. We'll be back next week with another Children's National expert, so I hope that you'll plan to join us for that. And again, Dr. Bellard, thank you so much for being with us. For now, we're glad that all of you had joined us today, and I'm Barbara Harrison. Thanks for watching.